in terms of herd immunity, your former colleague, Dr. J.P. Mulyal, has today suggested that every day India is seeing about, the actual number is probably closer to 1 crore new infections every day rather than the 3 lakhs that we're seeing. So does that indicate that we will be quickly approaching herd immunity? If you can just break up for us the achieving herd immunity through natural immunity as well as through vaccines, that could be a good segue into a more detailed discussion on the next phase of vaccinations that are due to happen in India.
Sure, Timothy. So what we've really learned, and this is something that we always knew about infectious diseases. There's been so much of confusion about herd immunity. So let me just define what we understand as herd immunity or population immunity. It is the benefit that the overall population gets because a large part of the population has already developed some kind of immunity, either because of natural infection or because they have received a vaccine. You can have a certain level of protection. This is protection against infection, and if you don't get infected, you don't transmit it to others. So the idea of a herd immunity is that a susceptible person amidst a whole lot of people who are not likely to get infected will be protected by virtue of the protection that others in the community provide them. So herd immunity is something that we all know exists with most infectious diseases that are of airborne or respiratory transmission. It's seen with measles, it's seen with other diseases as well, particularly where there's a person-to-person transmission. So having said that, herd immunity really depends on how many people are protected from infection. And how we define that is based on something called R0. Now, R0 or R0, we're all familiar with this thanks to the pandemic, is the force of infection or is the ability of a particular virus to spread in a certain environment. If that value of R0 is very high, then the herd threshold, as we call it, is also very high. If you have, for instance, in this case, we think that the R0s must have been at the beginning of the pandemic between 2.4 to 2.6 in many settings. And that would consequently mean you need about 80% of the population to be immune to infection before herd immunity will protect the other 20%. So the calculation behind that is complex, but the logic is very simple. If I am an infectious person and I need to reach a person out there in the community, if everybody around me, around the susceptible person, is not going to transmit the bug, my virus cannot reach that susceptible person. And that's the general idea. So what is the consequence of what I'm saying? Two things happen. One is, when we think about immunity, how immunity works is that when I receive the virus into my body reacts to it. You can have humoral immunity, as we call it, the production of antibodies, or you have something called cell-mediated immunity. Both of these work together to, on one hand, protect me from severe disease, and the other hand, protect me from getting infected again. And if I do not get infected again, I will not transmit it. Now, what we do know about the virus and about vaccines is that once you develop immunity, you're protected against disease. But what is not yet very clear, we have had very recent evidence in the last week that infection and vaccines partially prevent transmission as well. So if prevention of transmission is something that happens, then protection of the herd starts to build up. So the two things to be worried about here. Can we rely upon herd immunity to protect us? Unfortunately, no. Because for us to reach herd immunity, like I said, about 70 to 80% of the entire population need to be protected. And if you wait for natural infections to get us there, a lot of people in the interim will develop disease and some of them will die. But is herd immunity inevitable? Yes, the pandemic will finally die out because of herd immunity. So that's the two sides of it. How we reach herd immunity? Can we hope that herd immunity is what's going to kill the pandemic? At this point, no. We still need to try to break the speed at which the pandemic is moving ahead. Because there are two things that are happening. One is people are getting infected, and like Dr. JP said earlier, we have a lot of people getting infected. So when we see a few cases, there are 20 times or 30 times as many people getting infected each day. Now that's a good thing, because they don't have disease. They are asymptomatic, they're picking up the infection, they're spreading it to others who are also getting this infection, and consequently they're becoming immune. And once most of us get immune, then the disease will die out on its own. But if everybody gets infected rapidly like they are doing at this point in time in our country, the healthcare infrastructure collapses because a lot of people land up in hospitals seeking care. Our supplies run out, we don't have drugs. So when the first wave happened, this is what we asked ourselves, what's going to happen? And we knew within 45 days, if things went the way they did in Europe, we would have the crisis we are facing today. Fortunately for us, we don't really know why, but that didn't happen, right? So we got time to build our resources to make sure that we are ready for the next wave. We got time for our vaccines to get introduced. And yet, the second wave came a bit too soon for us. And here we are facing what the rest of the world faced about 20 years, last year, about 14 months back. So herd immunity is real. Herd immunity is a result of both natural infection and vaccines, but herd immunity is not going to stop the second wave. It probably will be responsible for the pandemic dying out, probably become more important in the third and the fourth wave being much smaller than it is today. What will help us today is the non-pharmacological interventions like masking, maintaining physical distancing, and trying to break infections as far as we can.